Hi guys, today I want to go through what to expect before some of your appointments and after your appointments. All of my patients come in super frequently and ask like, gosh, what can I do? Can I go out this weekend? I have a birthday party tomorrow. I have a big event tomorrow and they're scheduled for a full lip fill. Or maybe I have a 90-minute massage after this and I'm getting my Botox today. Well, no, girl, no, you're not today. We try to pride ourselves on giving our clients a sheet with their post-care instructions. It has our phone number, it has all the information to access us, because if you're anything like me, I will go to the doctor or any appointment, they will give me all sorts of information and I will sit there diligently listening, and then I will leave and everything just like floats out of my brain. So I'll be thinking later like, gosh, what did they say about that? Can I do that? Can I not? And it just becomes a loop in my mind about what I can and can't do. So before you come to any appointments with us, particularly Botox, filler, Sculptra, microneedling, under eye PRF, we tell you to be careful about what kind of products you're taking that could increase your risk of bruising. That could be ibuprofen, it could be fish oil, it could be vitamin E, aspirin, it could be a prescription blood thinner like a Coumadin, a warfarin, a Plavix, things like that. So be very careful with those. Make sure your injector knows what you're taking. On our intake forms, that is a question, but just make sure your injector knows what you're taking. Same thing with your workout routine. I tend to tell my clients, no working out for 24 hours after. With lip fills, maybe even 48 hours after your appointment, because you will get sweaty. That increases your risk of infection, but also if you get really sweaty and warm, your vessels dilate, which causes an increased risk of bruising. And some of us don't really like to bruise. So that's always an option too. Usually my clients tell me, absolutely no problem, Liz, I haven't exercised since 1995, or they say like, I can't go 12 hours, I teach yoga. Either way, we can figure out a plan where you can fit it into your schedule and it's the best result for you. I also tell people, try to not have any alcohol for at least 12 to 24 hours, because yet again, it's gonna increase your risk of bruising. I am a mom of 3. I totally understand your need for a glass of wine. I just want you to know that you might bruise some more. And a glass of wine might be okay, but maybe not the whole bottle, depending on how badly we don't want to bruise. Some of us are also more prone to bruising. I do tell my clients, a lot of them are very pale, very like pale complected, blondes, blue eyes, lots of redheads. And I love redheads. I have some, I love them, but you guys bruise like nothing I've ever seen before. So if you know you're gonna bruise, if you're prone to bruising in the past, that's also a good thing to let your injector know, because there's some supplements that we can recommend you take. There are some actually dietary things that you can take that will decrease your risk of bruising. I frequently will tell my clients to go get a supplement called Arnica. Arnica is a homeopathic supplement. It is fairly safe. It's not regulated by the FDA, so I can't really tell you that for sure. You can get it at a lot of natural or health food stores, and it decreases some of that bruising, some of that inflammation as well. I also will you'll hear patients that swear by pineapple. There is a chemical in pineapple that decreases some of that risk of bruising, so that's an option. Things like ice packs, if you're taught how to use them properly, will decrease some of that risk of bruising. I also tell my clients when they leave, especially with Botox. I saw a TikTok yesterday about this. This poor woman said, did you guys know you can't lay flat for 4 hours after Botox? And she'd been getting Botox for years and this poor girl never knew. So thank goodness she hadn't had any issues, but we don't want you to lay flat for a few hours. I tell clients, no laying flat for at least 4 hours. You can lay propped up on pillows and that's totally fine. I don't want anything tight around the area that you did get your neurotoxin. So no headbands, no hats. Try not to massage or touch those areas. Don't put makeup on. I always tell my patients, please do not go put makeup directly over a needle hole that I just put in your face. Because when we think about that, that needle hole just went through all those layers of your skin, and it takes a good 12, 24 hours to really even start to close up well. So if you take that nice foundation and you just shove it in there, that's really not optimal for our best healing practices. So the more that you touch, pick, massage lips, That's not good. We have so many germs on these hands. I don't care how many times you sanitize. You're putting it all in those needle marks, and I don't want that. I also will tell my clients they can ice, but they just need to be taught how to do it properly. So I don't want you sitting there with an ice pack directly on your lips for the next 4 hours. That's not ideal for your healing either. I will tell them if they get a headache, they can take some Tylenol. There's a lot of conversation being had about do I move my muscles or not? So sometimes my patients, bless their hearts, I love them, they will be afraid to move their faces for hours after we do their Botox. So they'll walk around and they're just staring like this. They don't want to smile. They don't really even want to talk. No, it's fine to move your face. It's not going to hurt anything. We actually encourage you frequently to use those muscles. So if I put some Botox in between your brows, I want you to every couple minutes, every hour, think about really making that angry face, because that can help that product get to where it needs to be and to work a little bit quicker. So those are great things to know. I do tell people as far as timeline goes, do not be the bride that comes to me 2 weeks before her wedding and books an entire syringe of lip filler, because we are not going to put lip filler in your lips 2 weeks before your wedding, my friend. You will not like me if I do that to you. Lip filler needs to be done 4 to 6 weeks, I would say, before any big event. So family pictures, you're getting an award, you're getting married, or you're going to be in somebody else's wedding. I need that 4 to 6 weeks for that filler to settle and for us to reassess. Same thing with your Botox. Do not come to me 2 weeks before your wedding or, 7 days before your wedding and tell me you want to get your Botox done. That's not ideal. We need that full, probably 4 weeks to get you where you want to be, to get everything settled and to make sure there's nothing that we need to tweak. So I want you to be happy. Obviously, these are important things. A lot of times they're photographed. I don't want you to be walking around with crazy swollen lips or a bruise in those photos. The other thing I like to tell my clients is afterwards, you will get a number and you should be getting some sort of follow-up contact information no matter where you go. That's very important to me. You will read some crazy, scary things on the internet. Please do not go on WebMD. Please don't go on Google. Call, text, or message your injector and ask them those questions. We do not care. I am never bothered. I would rather you call and text me than be at home anxious, breaking out in a sweat because you have a bruise and you're not sure if it's a bruise or if it's something crazy that you saw on the internet that somebody had done in some crazy country. So don't hesitate to get a hold of your injector. And I really hope that helps. And don't hesitate to get those follow-up instructions in writing so that if you are like me, you can put them on the fridge and not worry about what we said later. Thanks, guys.